Good afternoon, Alicia Loxley with you. The Victorian Premier Daniel Andrews is giving an update on the coronavirus crisis. We'll take you to that media conference now.
Thanks very much for joining us for the daily update and some very significant announcements about new measures, new rules for both metropolitan Melbourne and regional Victoria. First things first, there are now, in cumulative terms, 11,557 coronavirus cases in Victoria. That's 671 more than we reported yesterday. 73 of those are in connection with known and contained outbreaks or complex cases. 598 of those are under investigation by our public health team. I'm very sad to have to report that the total death toll now as a result of this global pandemic has risen to 123. That is 7 more fatalities since our last update. That is 3 women in their 70s, 2 women in their 80s, 1 man in his 90s, and 1 woman in her 90s. Of those 7 cases, 6 of those have a connection to aged care. If there's any further information that we can provide, then of course we will do that. Can I send my best wishes and condolences to each of those families? This will be a terribly difficult time for them, and our thoughts and prayers are with you during this very, very difficult time. We have 6,322 active cases. 385 Victorians are in hospital. 38 of those are receiving intensive care. In terms of health workers, there are some 649 active cases. Active cases with a connection to aged care, 1,053. And the metro regional split, again noting that there is some work still being done to reconcile these numbers. There'll be some further investigative work, but in broad terms, 5,829 in restricted areas, so Melbourne and Mitchell, and 328 cases in regional Victoria. Just before I go, tests I should also, we don't have an exact number today. There's still a bit of work being done around processing those tests, but we've done at least 1,651,953. That is around 18,000 more than our last update. Just before I go into making announcements in relation to new restrictions, both for Melbourne and for regional Victoria, I want to highlight one number in terms of daily numbers that is in many respects the most important number. As of today, and this number will only grow because, as I've just reported to you, there are 598 cases that are being investigated by our public health team. But as of today, from detective work that's been undertaken in recent days, we have 760 mystery cases. They are active cases where we cannot trace back the source of that person's infection, either who they got it from or where or how. Those mysteries, that community transmission, is in many respects our biggest challenge and the reason why we need to move to a different set of rules. If you've got that many cases, and they're not just in metropolitan Melbourne, they are in fact in regional Victoria as well. If you've got that many cases of community transmission, then you must assume that you have even more. And on that basis, you can no longer be confident that you've got a precise understanding of how much virus is there. Therefore, you've got to err on the side of caution and go further and go harder. Can I just, by way of introduction to these new rules as well, just make a point? The current strategy has avoided our hospital system being completely overwhelmed. The current rules have avoided thousands and thousands of cases each day and then thousands of people in hospital and many more tragedies than we have seen. But it is not working fast enough. And there are a number of different reasons for that. But after a lot of hard work, a lot of detailed analysis, our public health experts, as well as them speaking with their federal counterparts, and I'm sure some interstate colleagues as well, they provided advice to me that simply says if we were to pursue this strategy with a view to driving down numbers to a very low level, a containable level where we could reopen, it would likely be the end of the year before we were able to reopen. That's a 6-month strategy that is simply not going to work. Therefore, we have to do more, and we have to do more right now. So, following that detailed advice, I've made a number of decisions and I want to run through those for you. First of all, from 6 p.m. tonight, I am declaring a state of disaster across Victoria. This will be in addition to the state of emergency that has operated throughout. This means that police and others have additional powers. We can suspend various acts of the Parliament. We can make sure that we get the job done, and there's no question about the enforceability and the way in which new rules will operate. Beyond that, I have a new series of stage 4 restrictions to announce, and I'll do Metro Melbourne first, and then I'll go to the impacts for regional Victoria. So that state of disaster is from 6 p.m. tonight. Beyond that, the stay-at-home restrictions for Metro Melbourne will be enhanced. There will be additional limits to the 4 reasons to leave home. You will no longer be able to leave home or go any further away from your home than a 5-kilometre radius. You will not be able to be at any point more than 5 kilometres away from your home for the purposes of shopping for what you need. Only one person will be able to go shopping once per day, and they will need to secure the goods and services that are what you need within a 5-kilometre radius. In terms of exercise, recreational activity is now no longer allowed. You will be allowed to have 1 hour of exercise no further than 5 kilometres from your home. That means it's fresh air, it's a jog, it's a walk, it's in your local neighbourhood, it is staying close to home or in your home, and there will no longer be able to be any groups bigger than 2, regardless of whether they are from your family or someone else. Now, there will be common sense exemptions for children who are being cared for and can't be left at home, things of that nature. But ultimately, when it comes to shopping, one person goes out once a day and stays close to home within 5 k's. When it comes to exercise, it's no longer 3 sets of tennis or a game of golf or any of that. It is staying close to home and only once per day and only one person. That is really very, very important as well. The whole issue of 1 hour really puts beyond doubt some of those recreational activities anyway, because you simply wouldn't be able to conduct some of those things in an hour. Ultimately, all of these changes are about limiting movement. All of these changes are about limiting the number of people that we come in contact with. Daily exercise is just that. It's an opportunity to get some exercise. It is not an opportunity to live our lives as if this pandemic was not real and was not here and was not literally the biggest challenge we've perhaps ever faced. Just to go back to the beginning before I go on to regional Victoria as well, I just want to be clear, these changes are about making sure that we limit movement, that we have less people moving around. Today is about a series of changes that relate to how we live our lives. Tomorrow I'll make further announcements about how we work. They are 2 separate issues. There's a power of work being done around changes to some employment, places of work, I should say. There will be significant changes to a number of workplaces in terms of how much they're doing. Some will close. All of that is for tomorrow. I'll come back to that before I finish, just to provide some reassurance about things that will, under any scenario, remain open. The third area of change for Metropolitan Melbourne is that under those state of disaster provisions from 8 p.m. tonight, a curfew will be implemented. So there will be a curfew across Metropolitan Melbourne from 8 p.m. this evening, and it will run from 8 p.m. to 5 a.m. each and every day. And the only reason to be out of your home between the hours of 8 p.m. and 5 a.m. is to get care, to give care, or to go to and from work or be at work. We can no longer have people visiting others. We can no longer have people simply out and about for no good reason whatsoever. It is not an easy decision to make, but it is the decision that is necessary, and that is why I have made it. And that's why police will be out in force, and you will be stopped, and you will be asked, and you will need to demonstrate that you are lawfully out and that you are not breaching that curfew. Going to a mate's place, going and visiting friends, being out and about for no good reason, all that will do is spread this virus, and therefore that curfew will apply from 8 p.m. Tonight. Now, moving on to regional Victoria, it is with some regret, but given the significant community transmission and the growing case numbers and the fact that we need to stay ahead of this in regional Victoria, from midnight next Wednesday, regional Victoria will move to stage 3 restrictions. That's stay at home except for the 4 reasons to leave. That will mean that restaurants, cafes, bars, gyms, a whole range of other settings, we're well and truly acquainted with those, will need to close from midnight next Wednesday. That is not the position we wanted to be in, but we cannot have a situation where this continues to grow and grow in regional Victoria, and then we have a situation where, as we are perhaps bringing stability and reduced numbers to metropolitan Melbourne, we have a problem that is even larger and spread right across regional Vic. We just can't have that. So those changes will come into effect from midnight Wednesday night. That gives all of those who are most affected, gives them some time to be able to adjust to that. That notice period, I'm sure, will be important to many of those businesses that will need to move to a takeaway only or a home delivery model. Now, tomorrow, I will have more to say about different industries, and there will be three categories of industries. Those that are business as usual, and I want to assure all Victorians, supermarkets, the butcher, the baker, food, beverage, groceries, those types of settings, there will be no impact there. In terms of a number of other industries, they will be reducing their total output. That'll mean there are less people working less shifts. That'll mean there is less contact, there is less seeding of this virus from workplaces back into families and from family to family and right throughout the Victorian community. And then there will be a third category of business, and they will close. And they will move exclusively to a work from home, and if they can't work from home, then the work simply won't be done. There is a lot of detail, very complicated supply chains and other issues. They are being worked through, and I'll have further announcements to make tomorrow about that. I just again want to make the point that there's no need to be queuing up at the Coles or Woolworths. There's no need to be queuing up at those sorts of, or the local baker or butcher. They will remain open. They will remain able to provide you with the things that you need. Takeaway meals, home delivery meals, they will remain as they are now. It is essentially a whole series of large workplaces, and we will work through those in a painstaking way. We already have been for the entire weekend. That work is being finalised today, tonight, and we'll have further announcements about that tomorrow. And that won't be instantaneous. There will be some time to adjust, but that is not for today. Today is a series of restrictions that are about how we live. Tomorrow will be about a series of restrictions that relate to how we work, and that is the best way to do this. It is complex, and you're best to get it right and take the time to engage deeply with those that will be most affected. Just a couple of other matters. There will be changes to schools. So from Wednesday, we will move to flexible and remote learning for all students in all schools right across the state. So what that means for metropolitan Melbourne is the year 11s and 12s will go back to learning from home. Special schools will remain open for those who really need to be in those settings, and the children, the students of parents who are working, they will be able to go to school and be supervised, but it really will be only those that are absolutely necessary to do so. So we will be, if you like, reducing the total amount of students that are at school, and therefore the total amount of movement. In regional Victoria, they will move to remote and flexible learning for all students, but there will be, I think, larger numbers of students that are allowed to be at school because their parents are working. That economy in the regions will be functioning at a higher level, and we won't be limiting the number of students who can come and be supervised because they simply can't be supervised at home. I want to make the point, as we have consistently, that vulnerable children, children that really do need that in-school experience, they will get that. They will be supported. There will be a slight difference in terms of the numbers of students that are presenting because there's no alternative metro versus regional, but we'll try and provide every support that we can to every single student. That means tomorrow's a normal day of school. Tuesday will be a pupil-free day across the board, and we will then move to flexible and remote learning for all students come Wednesday. Again, that is a difficult decision, but if you think about it just from regional Victoria, that's more than 100,000 people who are not going to be moving around regional Victoria who otherwise would be. These are tough choices, but they are the decisions that I've taken because they're the decisions that will keep us safe and get us past this. We can't have a 6-month strategy. These restrictions will run for 6 weeks. So from 6 p.m. tonight, those that I've announced that are relevant to that, 6 p.m. Others from midnight Wednesday, they'll run out until the 13th of September. 6 weeks versus a slower strategy, a much, much slower strategy that takes up to 6 months. I'm not prepared to accept that. I'm not prepared to accept days and days and days of hundreds of cases and more death. These are very significant steps. They're not taken lightly. It's very challenging, but it's exactly what we have to do, and that's why I'm here before you announcing it. There are, I'm sure, many questions out of the announcements that I have made. If I can just again summarise it, from 6 p.m. tonight, you can go shopping, one person per household. You've got to be within 5 kilometres of your home. A daily exercise means just that, 1 hour, no more than 2 people within 5 kilometres of your home. In terms of the curfew, the only reason to be out after 8 p.m. tonight, between the hours of 8 p.m. and 5 a.m. on any given day, is if you are at work or if you are giving care or getting care. These are big steps, but they are necessary. We have got to limit the amount of movement, therefore limiting the amount of transmission of this virus. We've got to clamp down on this and get to the point where we have much lower numbers as quickly as we possibly can. There'll be more for us to say about businesses tomorrow. There'll be more for us to say about enforcement, about fines, about the penalties and the processes to hold people to account if they're not doing the right thing. That's more for tomorrow. But I just want to finish, before we go to questions, I just want to finish by indicating I've had communications with the Prime Minister throughout the weekend. We spoke at length this morning. And there is an acknowledgement, of course, that JobKeeper and JobSeeker at the current rates continue out until the end of September, so well beyond the window, this 6-week window that we're talking about today. We're going to continue our discussions, and if there are any areas where there are anomalies, any areas where businesses might not or workers might not qualify for those payments when clearly they should, because it's about addressing hardship, then we will continue to work through those issues. I was very encouraged by the Prime Minister's partnership and his sense that we are all in this together and providing support, particularly income support and potentially cash flow support beyond that for businesses, is something that we need to work closely together to do. I'll have more to say in coming days about business support, noting that there is a lead-in until midnight Wednesday. I'll have more to say about the types of restrictions within the economy, types of changes to the way we work, and the types of support we will provide to all those affected. But that's not for this media conference. That'll be for today and the days after it. So I know that's a lot, but on that basis, I'm happy to take any. All of us are happy to take any questions. And obviously, the Health Minister is here, the Police and Emergency Services Minister here is here, and the Deputy Premier and Education Minister, and of course the Chief Health Officer is here too. At this stage, you would be liable for a $1,652 fine.
Is that enough?
I think that's enough if you were particularly willful. There'll be a little bit of, there'll be common sense. There'll be a little bit of, there'll be fairness. But the time for discretion, the time for accepting some of this behaviour is over.
Isn't one of the reasons we're in this problem is that not enough people have complied with the rules, and is it time for tougher restrictions?
Well, as I said, as I said, I'll have more to say about fines and penalties and enforcement soon. Today's not the day for that. But anyone going out and breaking that curfew, you run the risk of being caught, you run the risk of being fined, and we always reserve the right not just to fine you on the spot, but to take you to court, and then it's not $1,652, it's actually $10,000. So this will be over sooner if everyone does the right thing, everyone plays the part that they have to play. Again, I know I've said it many times, I don't want the selfishness of some to detract from the amazing work that the vast majority of Victorians are doing. I'm deeply grateful to each of you, but these steps are the ones we have to take. These are the decisions I've made, because anything short of this will not keep us safe. Anything short of this will see this drag on for months and months and months. That is not acceptable to me. Having to stand here every day reporting more and more people dying, we need to come down on this hard. This is what this strategy is all about. we've avoided the worst case scenario. Now we have to get to that COVID normal, and we have to get there as quick as we possibly can.
We heard several times last week that this kind of lockdown might not necessarily work because of the transmission that was happening in essential industries.
Yeah, and that's why we'll have more to say. Well, there's a couple of points. We'll have more to say about those industries and the way in which they'll have to operate. And as I said, there'll be some that can continue. There'll be some that will have to reduce the amount of work they do, the amount of output, therefore the amount of workers, and therefore the amount of risk. And then there'll be others that will close, just as other businesses have moved to working from home. That will not be easy. Today's not the day for that. We'll have all of that finalised, and we need to. There's a lot of national issues at play here as well, because obviously we have the biggest container port in the country. What gets turned off here will have a direct impact right across the nation, and indeed right across the region and the world when it comes to issues of export and the like. So it is quite a complex task, and one that we'll be able to talk to in more detail tomorrow. The other point I would make is that number of mystery cases, that number of community transmission cases has steadily grown. It is now at an unacceptably high level, and that's why the advice has changed, that if we don't take these steps, then we're just going to see more and more cases. That may mean that our strategy doesn't work at all, even if you were to wait 5 or 6 months. So when faced with that choice, more is needed. If this is not enough, we need to do more. And once you get that advice, that's exactly the tough decisions that you have to make.
Some of these industries, advertising networks, will obviously be under increasing uncertainty today. Have you sort of finalised the decisions on which industries will be shut down?
No, there's still further work going on, and that will be concluded as soon as it possibly can be. As I just said, it's not as simple a task as it might seem. There are very detailed supply chains. There is a good deal of complexity to this issue. It is better to take a little bit longer to get it right. These changes won't come into effect until Wednesday at the earliest. So on that basis, we do have a little bit more time to engage to make sure that we've got it as close to right as it can ever be. There'll always be grey areas. There will always be challenges as we go in the days after we make these announcements. But getting this right is really important to us, and that's why we're engaged with the Commonwealth Government, with the National Coordination Mechanism, with the Department of Prime Minister and Cabinet, all of our government departments. It's an important process to make sure everyone has a line of sight and knows what the implications of each and every decision we make are.
This lockdown ends on September 13 or 14. Firstly, do you envisage that we'll go back to stage 3 restrictions then? Secondly, how likely is it that we could get on top of that sooner?
Well, 6 weeks is the time that is necessary. If everyone plays their part, then there is some prospect that we could achieve our outcome before then, but I'm not making any commitments on that. I'm not for a moment suggesting that if we got to a certain threshold, we'd be able to go back to these restrictions prior to me standing up today, or another level. Ultimately, we'll have to be, just as we always have been, guided by the data, the evidence, the numbers, and the detailed analysis of those numbers. Again, the notion of 700 perhaps doesn't seem a very high number in the context of some of the numbers we've had to report, some of the challenges we've had to describe and deal with. But that many mystery cases where we just can't track back who you got it from, how, when, that's when it's really, really challenging. And what that says to you is that if there's that many mysteries that you know about, how many cases don't you know about? And that's when you've got to take an abundance of caution and say, look, well, let's extinguish this. Let's get this to the point where it's down to a very small number, a manageable number, and that's the advice to me, and that's the decisions we've taken.
Those mystery cases, I mean, should we see that as a failure of contact tracing, or is it a matter of capacity being overrun?
I think volume is the friend of no system. If you've got this many cases, if you've got this much community transmission, for whatever reason, then it really gets very, very difficult to put your arms around and to contain the sorts of numbers we're seeing. Now, is it running wild? No, we're not seeing thousands of cases a day, but the best we could hope for if we didn't make these decisions, if we didn't make these changes, if I ignored the advice rather than following it, would be that we might get ourselves into a low number in 4, 5, 6 months' time. That, I think, is just not a feasible option, and that's why when your current settings clearly are not enough and you've got advice to change, that's when you have to do more, and that's exactly what I've done.
Given that we
We've had many discussions about asymptomatic testing. There's only so much testing capacity that you have on any given day, and the reward for effort is very, very low. We have done asymptomatic testing where the medical experts deem that that's an appropriate thing to do in a high-risk workforce, for instance. You'll recall we did asymptomatic testing of many thousands of teachers. We've done many asymptomatic tests as a result of our outbreak policy and trying to respond to those outbreaks. We've got no announcements to make about changes to the testing protocol. I would just say again, if you're sick, you need to get tested. That's the most important thing to do. In fact, it's the only thing to do, and we'll get you your result as fast as possible. And in the interim, you have to stay at home while you wait for the result. And if you're positive, you have to be at home. I'll have more to say tomorrow about enforcement. I'll have more to say tomorrow about a big boost to that door knocking program. It's already very substantial, but it's going to go to an entirely new level, and that'll mean that we've got greater confidence that people are where they should be and are doing what they should be doing.
OK, we're going to leave the Premier's press conference there. If you'd like to continue watching, you can go to 9news.com.au. I'll just recap the main points for you. From 6 p.m. tonight, Victoria is under a state of disaster. That means additional powers for police. Melbourne, as you heard, is moving to stage 4 restrictions. That means one person per household can go shopping once a day within 5 kilometres of your home. 1 hour of exercise is allowed, no more than 2 people, also within 5 kilometres of your home. And there is a curfew from 8 p.m. until 5 a.m. for the next 6 weeks. And from Wednesday, all students will go back to remote learning. So a lot of announcements there from the Premier, and more announcements to come tomorrow regarding workplaces. Apologies for the interruption to the netball. You can head to 9Now or wideworldofsports.com.au for all the results and highlights. All of the details from the Victorian Premier's announcement also coming up in 9 News tonight at 6. Bye for now.